Amazon is shaking up the competition in the healthcare industry by launching a new online pharmacy. The service lets users buy their medications on their phones or other devices and have them delivered to their doorsteps in a couple of days. Amazon says it will offer discounts on prescription drugs for those who buy without insurance. The pharmacy will offer both brand name and generic drugs. So to talk more about this, let's bring in David Kirkpatrick. He's the founder and editor-in-chief of Technonomy. David, Amazon Pharmacy marks the company's biggest push into the $300 billion drug retail sector. When you say it that way, $300 billion, and then the question is, why would Amazon want to jump into this industry? I guess that's the answer.
That is the answer. Actually, Amazon has a very long practice of looking at where the profits are, where the scale businesses are, and entering with a more efficient and often more consumer-friendly and inexpensive service. And I think they can do exactly that here.
So, here's the thing that I think is a little concerning about Amazon is, and I'm a regular Amazon user, this company knows so much about me.
I was going to say.
They know the music that I like. They know the groceries that I buy because I also shop at Whole Foods. They know the things that I wish for that I haven't even committed to yet because there's a wish list out there. And now they could know a lot of stuff about my health as well. How concerned should we be?
Well, it's a legitimate question, and you should be concerned. And they are not the only company that is assembling a vast store of information about most of us. I certainly think Facebook probably has even more information about most Americans. On the other hand, the benefits that we get from their services typically are considered by people more than sufficient to counterweight the potential privacy invasion that's involved. I think it's something we're going to have to keep watching, both as a society and as individuals, for and endlessly, really, because there is a very frightening reality that has emerged that a small number of companies are almost as powerful as governments and have vast stores of information about the public. But they are getting that store of information because they offer us services that we want. And I think in this case, the trade-off may very well be worth it. For me, I would say it is.
Yeah, it's tough, David, because, I'm thinking about the efficiency, the fact that you can get these delivered to your doorstep. And it's much the same way that I thought of Amazon. I was an early adopter back in the late 90s to Amazon. I'm a huge bookworm. Anne-Marie knows this. But I love the idea of going into a bookstore or a library and thumbing through books and, going to the counter with a stack of them. But it became so easy to buy books online. And certainly everybody feels bad about small bookstores going out of business. But you're talking about, 300 plus million people, Americans who want that convenience. And I wonder about the same thing here. I was just saying to Anne-Marie that, you do establish a relationship with your pharmacist, that when you go in there, they kind of know what you're getting if you're on, sort of monthly medications or whatever, and if something doesn't come in, they call you and they say, here's what's up. Will that, that's not going to be enough to outweigh the convenience that Amazon is offering here?
Well, I'm not saying Amazon's going to take over the whole retail prescription market in 5 minutes or even possibly ever. I actually think one of the things that's happened during the pandemic is that CVS and Walgreens and Walmart, which is also in this industry, have strengthened their ties with consumers. People have felt more dependent on them. I mean, for example, they've told us recently, you got to get a flu shot. Right? You're not going to go to Amazon to get the flu shot. You're going to still go to that same pharmacist you already knew. And I think that may continue, and those relationships are real that you described, Vlad. And I don't think they're going away. Amazon's not going to just walk in and take over everything. On the other hand, they're saying they can give you an 80% discount on prescription, on generic drugs, even without insurance, and as much as a 40% discount on non-generic drugs. Now, if the saving is enough, and we know that Amazon, as you say, in books, offered us sufficient savings that, and I'm a book person too, despite our love of bookstores, it was hard not to take that 40 or 50% discount, and sacrifice our loyalty to the local bookstore. And these things are the factors that consumers have to weigh. And people are very cost conscious, and probably more now with the economy in such difficult situation as it is. So it's a good time for Amazon to create this offering.
Yeah, I think, that's always concerning, the way Amazon can be disruptive to a certain area, business. And then I think about all the people out there, which is kind of significant, that don't have bank accounts, don't do this sort of stuff online, and how I see a two-tier system where those people end up paying a lot more for their drugs than other people who do have access. I know I'm going way off into the future, dystopian and all that kind of stuff, but I think about these things. What can I say?
No, those are
David Kirkpatrick, I know you have
legitimate
to leave
questions.
us.
Very legitimate
Okay,
question.
good. So I don't feel like I'm crazy. Not about this, anyways. David Kirkpatrick, thank you so much.
The fact that so few Americans are connected to the internet is a big problem, but thank you so much for having me.
But hold on, that's a great point, David.
Yeah.
Just to button that up, you're right. You're talking about in some parts of the country, rural America doesn't have that internet access that we might share in urban areas. That's an excellent point.
It's not only rural. There's a lot of poor parts of the cities. The same thing is true.
There you go. Great point, David. I know you have to go, but I think that's a great point. That's even in the city, people do not have access. And even in big cities, people do not necessarily have bank accounts or bank cards or credit cards. And this sort of economy is dependent on that. And there's a huge chunk of the American population that gets left out. And they're probably the people who need the break the most on the price of their drugs. All right, David Kirkpatrick, for now, thank you so much.
Thank you so much. Thanks for having me.